Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today is a returning guest to the show. He is a neurologist at Rhode Island Hospital. His name is Dr. John Cahill. Welcome back, sir.
Thanks very much. Thanks for having me.
You're one of my favorite guests because we always have a good time. And there's not necessarily an agenda per se about what we'll talk about, but you're a neurologist. So let's start with that. Define what a neurologist is.
A neurologist is a physician, a medical doctor who specializes in taking care of patients with disorders of the brain and the nervous system. So the brain, the spinal cord, what we call the peripheral nerves, which are the nerves out in the arms and legs, and muscles. So my specialty in this area is multiple sclerosis, but the most common things that a neurologist might see are people with headaches, seizures, strokes, Alzheimer's disease, Parkinson's disease. All of these are neurological disorders.
Is the brain still, to this day, even with all our great medical advances, still the most unknown part of the body as far as, I know we're learning more, but
oh, sure,
it's vast.
Absolutely. There's a lot that's unknown about it. There's a lot of research going into it in a lot of different ways. The brain is really protected from the outside world. Obviously, it's in the skull, but even in other ways.
They don't want you tinkering around
exactly.
in there. Yeah,
so it's hard to see exactly what's going on in there.
Even with MRIs and X-rays and
absolutely.
stuff? Absolutely.
There are many things that we can't see on MRI. Most of those things I just listed off, for example, migraine, headaches, Alzheimer's disease, those aren't things that are visible just on an MRI scan or a CAT scan or something like that. It takes largely people in my profession and neurologists. We learn a lot by examining the patients and seeing the neurological exam changes in the rest of the body that reflect changes going on in the brain.
A human only uses, what, 10% of the brain or
That's
less than that?
That's what they say. I don't know.
You question that?
Yeah, it's hard to say.
Right. Well, there was a movie.
There are definitely parts of the brain that we don't really know what they do.
Right. Well, let's just take it out and see what happens.
Yeah.
A lot of crazy experiments by mad scientists, I would imagine, could answer those questions.
Over the years, there definitely have been, for sure.
But we do it the right way now. And are you learning? Obviously, you're learning every day, right?
Absolutely.
Where in the field, neurology in general, of all those things that you mentioned, is the most progress being made right now?
Well, I'm a little bit biased in this regard because I spend a lot of my day focused on multiple sclerosis, but there have certainly been a lot of advances over the past 20 years and a lot of advances over the past year or two. It's a very dynamic field.
But a lot of promise?
A lot of promise, definitely. Multiple sclerosis up until 1993, there were no medications that were proven to benefit or proven to help people with MS. Now we have 12 on the market. There's probably going to be 2 more coming out in 2016 with FDA approval. They all show benefit in reducing the disease activity in MS. MS is a disease that doesn't have a cure, so you have to suppress the disease activity with medication over the years.
Define MS for me.
Yeah, multiple sclerosis is a condition of the brain and spinal cord. I like to describe it as a condition of inflammation. And the cause of that inflammation is your own immune system, the body's own immune system. It's an autoimmune disorder. The immune system is made up of white blood cells, usually fights off infection, for example. But in autoimmune disorders, the white blood cells, for example, attack your brain and spinal cord. And people with MS have episodes over time where the white blood cells and the immune system attacks the brain and spinal cord. So they get a lot of variable symptoms, and the medications prevent the immune system from performing that attack. All of the medications really target the immune system in some way.
Right, because that's how diseases are cured, or at least treated. You're not actually treating the disease, you're treating your own immune system to attack the disease, right? To identify it?
There's a lot of interest in that in a lot of new diseases. There was recently, a lot of press about certain brain tumors can be fought by modifying the way the immune system attacks tumor cells. In MS, we really try to turn down the immune system. The problem is that the immune system is overactive, it's too active. And there are other autoimmune diseases. MS is the autoimmune disease that affects the brain. Something like rheumatoid arthritis is the immune disease that affects joints. And lupus is an immune disease that affects the heart and skin and kidneys.
Since MS is about the swelling or inflammation of the brain, dumb question to ask, but in other parts of the body, you can decrease inflammation with a certain drug, even over-the-counter stuff. Obviously, the
Sure.
brain is a jillion times more complicated, but is it possible to just simply reduce the inflammation?
Yeah, it doesn't work.
You've tried it.
Yeah, certain things that people think of with inflammation are non-steroidal anti-inflammatories, like ibuprofen is
Right.
an anti-inflammatory
Right.
that you might take if you have an arthritis in your knee. But those types of medicines are not strong enough either to get to the brain or really to treat these overactive immune problems. When you get inflammation in the knee because you ran too far, that's a natural response of your body's systems. But when you have an autoimmune disease and the immune system is revved up, medicines like that aren't effective.
I know it's not your field, but isn't AIDS also a disease where it's the immune system itself that breaks down and just doesn't function properly?
Yeah, the virus HIV that causes AIDS basically destroys the immune system.
Right.
So the problem with HIV and AIDS is that the immune system is nothing. It's the same system, but it's kind of the opposite of MS,
Right.
where you need to rebuild the immune system. It's underactive. And so people with AIDS, the problem is that they get infections of all different kinds. They
Right.
get very unusual infections or viruses and bacteria that in a person with a normal immune system might be basically harmless,
Right.
cause a common cold, can cause real damage in people that don't have the immune system to fight it off.
Okay, back to MS, because we were talking off the air before the show started about there's a lesser known version of MS that is now, drugs will be available for it.
Yeah, so that's one of the most exciting things going on in the MS world these days is that we've had for 20 years medicines that reduce inflammation in the most common type of MS, which is called relapsing remitting MS. And that's what I was talking about, where people have these attacks over the years called relapses and remissions. And if you can suppress the immune system with these drugs in some way, it reduces relapses. There's a less common type of MS. Probably 10 to 15% of people with MS have a type called primary progressive MS, which is a slower process. People develop injury or damage to the brain and spine more slowly over time. It usually starts as a little bit of trouble walking, but then progresses to more difficulty walking, trouble with vision, trouble with balance over the years. And for the first time, there is a drug called ocrelizumab, which we expect or we hope will become FDA approved by the end of 2016. They had 3 clinical trials that were presented last year at these big scientific meetings that showed in one of those trials, they slowed the progression of primary progressive MS. And that's been a real difficulty in the field of MS research and MS treatment, that we haven't had anything that has done that until we hope, hopefully the end of this year. So that's been a real breakthrough in the scientific world and a real, benefit to this. Granted, it's a minority, but still a large number of patients who have what's called primary progressive MS.
Just the fact that it's been identified and it exists, maybe, not that long ago, probably wasn't even
Right.
a real thing.
Right. And interestingly enough, the drug is still an immune drug, so it still has effects on the immune system. And again, it's shown to slow the progression in people with primary progressive MS. So that'll be what our 13th or maybe 14th drug on the market. All of them are focused on the immune system. There are drugs now being researched that target different aspects of MS. So it's not all inflammation. At some point, the disease kind of changes and people start to have nerve cells or neurons die off without a lot of inflammation. There are thus far no drugs for any disorder that are shown to regenerate nerves, regrow nerves, or promote what we call neurorepair or neuroregeneration. So those drugs are in trials and some of them look promising. So I'm hopeful, I think everybody's hopeful, that in the next 5, 10, 20 years, there'll be a combination of drugs used to treat MS and other neurological disorders where you have some suppression of the immune system, but also some rebuilding of the damaged areas.
So the future for MS research and testing looks very promising.
Absolutely.
There's definitely a light at the end of the tunnel on that one. Another thing, only because the society in general is aging, Alzheimer's is a hot topic these days too. Can you talk about that a little bit?
Yeah, huge important problem. There are some reasons for hope there as well. interestingly enough, they're using some of the immune drugs to treat Alzheimer's in some of its early stages and showing that they may be able to prevent the progression of Alzheimer's disease. Alzheimer's disease is a memory disorder where people lose memory. Generally, they're elderly. And so as you point out, as the population gets older, it's a big, big problem.
But progress is being made.
Some of the early clinical trials in these immune drugs for treating Alzheimer's disease had some difficulty. They were causing some bad side effects. But some of the more recent ones look more promising, and we're hopeful that there'll be a way to slow down Alzheimer's disease because it's going to be,
It's a big deal.
It's definitely a big deal. It robs people of their independence, their memory, their mind, really of themselves, kind of.
And it really affects their family and friends and loved ones around them too.
Very much so.
A lot of diseases are obviously like that. When you don't have control of your own faculties, whether it's physically or mentally, it affects everybody around you and
Absolutely.
Society in general.
Absolutely, and society in general. I think most people know someone either in their family or a close personal friend who's had Alzheimer's disease, and most people have some understanding of how devastating it can be to the whole community. So we really need desperately medications that help that and research in that field as well.
Do you think the word is getting out enough as far as, because depending on the disease, there's great promotion, like the NFL and with breast cancer, and there's always somebody big who, if they back the promoting and the awareness of a particular disease, that's used. It raises money, raises awareness, and gets the word out. And obviously that dominoes into research money and just getting a little bit closer to finding not necessarily a cure, but proper treatment.
Yeah, that's true. A lot of the diseases have very specific organizations. I'm involved with the National Multiple Sclerosis Society in the New England chapter, and the National Multiple Sclerosis Society nationally really tries to raise money to promote awareness as well as research. As the National Institutes of Health funding rate for multiple sclerosis has gone down, the MS Society has really increased to make up the difference.
Stepped up, yeah.
And nowadays, just about every disease has this, an organization. The Ice Bucket Challenge is the best example of a rare disease.
They
Lou
took
Gehrig's
advantage
disease,
of
ALS.
social media.
Absolutely. Lou Gehrig's disease, ALS, which is a terrible neurological disease. It's a rare disease, like MS, but for that organization who found that thing, took advantage of social media and raised millions and millions of dollars to fight that disease and that research. And all of these organizations kind of collectively are trying to lobby Congress and others at the state level to increase research funding, to increase awareness. That's why we're all out doing walks and runs.
Yeah.
And bike-a-thons.
Going on shows like this, right?
Coming on shows like this.
Well, this is a good opportunity for us to take a break. What's the best website to give out for people? The Rhode Island Hospital website, or you have a different one that you want to give
The
out?
Rhode Island Hospital Multiple Sclerosis Center has a website.
Okay.
Where we have information about what we do and the people that work with us in taking care of people with MS, predominantly in Rhode Island. The National MS Society, certainly, their website is a great resource for information about MS and about some of the funding, fundraising, and research that's going on in MS as well.
All right, we'll put a graphic up on the screen for that, and we will take a break. Dr. John Cahill is a neurologist at Rhode Island Hospital. We'll take a short break and come right back. I'm Sean Murphy. This is For the Record. Stay with us. Welcome back to For the Record. I'm Sean Murphy. Dr. John Cahill here. He's a neurologist. He works at the Rhode Island Hospital. His specialty is MS. We talked about that. A lot of other things. Another big thing in the news today, as we transition to sports, is the concern over concussions. That's a big deal with kids and also professional athletes as well. And it's a brain issue.
Absolutely. This has become a big story. It's big in the medical community. Essentially, people from Boston University a few years ago described that in the brains of people who've had recurrent concussions and in some former NFL players, it looks almost like the brain of a person with Alzheimer's disease. Some of the same proteins are there microscopically. They call it chronic traumatic encephalopathy, or CTE. And they're trying to figure out whether repeated concussions might lead to that brain disease.
It's a swelling of the brain as well, right?
There's some swelling around it, and there's these abnormal proteins that get deposited in the brain. And the symptoms that people might have from this are pretty variable. So some people they've even found without symptoms have this abnormal brain under the microscope, but others, become agitated, their personality changes, they lose memory. In extreme cases, I think Junior Seau had this pattern on his brain. He ultimately committed suicide, they think possibly as a result of this condition.
And amazingly, he did so in a way that allowed doctors to examine his brain, right?
Right.
And that was an unbelievable story.
Yeah, a lot of the, I don't want to just pick on the NFL, but a lot of the former NFL players are really interested in having themselves or their own brains, when they died, having them studied and examined.
But now they're also, even as their career is over, they're blaming their game and their league for, conditions that they have now if it's identified.
Sure. It's hard to go back in time and figure out, which of these people, because not everybody gets it. That's the other thing.
Right.
So there have been a lot of people who've had multiple concussions and a lot of head injury over the years who ultimately die and their brains look pretty normal, or just like they would be at their age anyway. So it's not clear. There might be a risk factor that we don't yet know about why some people this happens and some people it doesn't. Nobody really knows what to do about it.
There's a protocol in the NFL where, at the very least, if you get it, you got to sit out, the next game and sit out the next play and stuff like that. And as far as the NFL is concerned, unfortunately, it's probably on their end a concern more about being sued, so it's a money thing more than a concern about medical thing, right?
Although I think they have a neurologist on the sideline or at the game of every game. I wonder how to get in on that. But,
free games,
yeah,
and you're doing your job anyway.
I haven't yet figured it out.
Do you think now? We talked about the NFL. Now let's go back to all the way to the youth level, where parents nowadays are keenly aware of this problem and are now considering whether they would even want to allow their kid to play, tackle football, contact football.
Yeah, it's really hard to know. I have a 2-year-old, and I don't know what I'll decide. What would be best for her? It's really
well. As a neurologist, I think you would have the most educated, opinion about whether,
I think, they're doing a lot of studies nowadays, even at these lower levels, not just professional athletes, but college athletes. Brown University is doing studies on helmet technology and helmet design that might reduce concussions. And
it'll get to the point where we get into those giant plastic balls that you see on commercial there, or it'll switch to flag football. So that's what some people predict. And it's not just football. Soccer has its. Most of the sports have issues where there's a concern about head trauma, injuries. It's a big deal. Are you at a point where a kid's brain hasn't fully developed until a certain age? Is that what it is?
Well, that's true. Everybody, has development probably of the brain up until about age 19 or 20, and even beyond that to some degree. But most of the brain is pretty well formed by that age. So is the impact on a developing brain different than the impact on an adult brain? That's the stuff we don't know.
Right, and that's and now there's a movement going around, I believe, about wanting to ban kids under a certain age from heading a soccer ball. You can play soccer, and you just have to worry about damaging your legs and shins and everything. but the trauma to the head, to the brain, that's a big deal.
Yeah, and a lot of this is, in a space where we don't know what the right answer is. People think that might be a good idea to limit young kids. I think that makes sense to limit young kids' exposure to head trauma.
My mom let me play football, and it was fantastic, and I loved it. But to be honest, I think she was just ignorant of what people know now about. Like, if she was really into it and understood, she might be very concerned about her little boy playing football now and would try to steer me in another direction.
Yeah, and I don't know about how the sport may have changed a little bit too. I think concussions are more widely recognized now. may be happening more frequently than they used to, but they're certainly more widely recognized.
Or the more identified, all the
Yeah.
things you said earlier about these are things that we don't know, the developmenting brain at young age, but there's awareness, and I think that's the key first step, right, in
Yeah.
anything.
Absolutely.
All right, so when we're talking about brain issues and, from one extreme, concussions, a head trauma, to things that affect the brain, big thing in the news now is the Zika virus.
Oh, yeah.
Yeah, and so, we're getting ready to, what's happening soon? The Olympics are starting up soon,
Right.
right? So
Yeah, they're spraying for all the mosquitoes. So
what is the Zika virus,
yeah,
first
so
of all?
the Zika virus, my understanding is that I don't have a great deal of exposure to it. We certainly
Right.
don't have any cases of Zika up here, but it's a viral infection that is transmitted by a mosquito bite. Fortunately, for those of us that live in Rhode Island and Connecticut area, we don't have those mosquitoes yet.
No, we have West Nile or
Yeah,
whatever.
we might get those mosquitoes
Yeah.
one day, but it might actually be too cold for them up here. We'll see. The CDC, I think, predicts that those mosquitoes are going to get up as far as New Jersey. I don't know how
Yeah.
they.
Who's going to notice in
Yeah.
New Jersey, right?
But it affects the nervous system in two ways. The most common one that people have seen is that we think it causes microcephaly, which is a abnormal development of the brain. So in pregnant women who are infected with the Zika virus, their babies have a higher rate of small heads and small brains, microcephaly. So the brain just doesn't develop as largely as normal. And that will probably lead to, in those babies, some developmental problems as they grow. The other thing that it seems like the Zika virus can cause is something called Guillain-Barré syndrome, which is a condition where you lose function of your peripheral nerves. These are the nerves out in your arms and legs. And you can get numbness or paralysis of the arms and legs after infection with the Zika virus. They found that actually in French Polynesia, there was an outbreak of Zika virus where they started noticing that at the same time that they had Zika virus outbreak, which usually causes a rash or an arthritis, and then it gets better, they started having a lot of cases of Guillain-Barré syndrome. And they are starting to notice that, I think, in Brazil as well, where there's a huge outbreak of Zika.
Right.
So,
People kind of think it started there, or that's
Yeah.
where it really got its notice, so
and
to
the
speak.
mosquito, has been around for a long time. I think there have been African cases of the Zika virus and that mosquito, but it's really blown up a couple of times over the past year. Last year in Brazil, and I think 2 years before that in these islands in the French Polynesia.
What is it about mosquitoes that seem to carry all these diseases all the time? Is it just their travel methods, or their physiology? Or?
Yeah, I think it's just that they are a vector, so they.
They go and bite other animals?
Yeah, exactly.
Yeah.
They travel between species, and it seems like they don't mind
Yeah.
biting humans or
Anything.
biting deer.
Yeah.
Lyme disease is a good example. It's transmitted by a tick, not a mosquito, but insects that take it from one species to another.
Back to the pregnant women, I always thought that embryonic fluid was the thing that protected babies the most, and it really was the thing that fought off diseases.
I suppose it is, and the, being inside the mother is really protective. But if the mother is exposed to things, and you can think of drugs or medications that usually we don't want to give to pregnant women, because if the baby, the fetus, is exposed to that, it can cause harm in a lot of cases. And an infection would be the same thing. If the mother gets a severe infection, it can cause changes in the baby.
We're almost out of time, and this isn't your field of speciality, but I thought I'd just have you comment on it as a doctor, just especially in our area, the issues we're having with opiates and the heroin outbreak here, especially in our hospitals down here. They're dealing with it on a daily basis. Can you talk about that a little bit?
Yeah, it's very, very, very prevalent and a huge problem that some of the medications that we've used for years to try to help pain, as those have become more and more effective and better at treating pain and higher potency, like fentanyl is a great example. That's the biggest problem now.
Is it a narcotic?
Yeah,
okay.
fentanyl is like a supercharged morphine.
Wow.
And when you take a lot of it, it can really cause a lot of damage. And so people that get hooked on opioid medicines can then, often because it's less expensive, get hooked on other things. Heroin is a similar drug to that. Fentanyl is another one that's being used, inappropriately on the street, and people are getting into a lot of trouble. People are dying every day as a result of overdoses on these medicines.
Do you like the Narcan approach to treating them in a quick emergency type situation?
I think that that's a good idea to have Narcan available for people, not just EMS people, but nowadays some family members of people that are hooked on narcotics and opioids are carrying Narcan in case there's an overdose. It's an effective treatment. I think it saves lives. I think it's not the answer to the problem,
right.
because
You're not getting to the root cause of the
yeah,
problem.
not getting to the root cause, but I think it's a very good start, and it's
Now, and in connection to that, there are now new guidelines coming on board for doctors as far as how they dole out the prescriptions.
yeah. I think different states are handling it in different ways. There's certainly more levels of legal. I don't want to say hoops to jump through, because I think they're there for a reason.
Yeah,
and they're
it's
good.
important. Yeah, it's
yeah,
necessary.
I think it's important. It's a little bit more difficult for me, for example, to write for some of these medicines. It's not difficult, and I can actually nowadays I can keep track of them. Our state, Rhode Island, has a very nice system. I know Connecticut has one as well. A very nice system for physicians to be able to keep track of their own prescriptions that they're writing. And if someone were, for example, writing prescriptions in my name, I could easily find out about it.
Right.
So
maybe you won't give a few refills out here and there.
yeah, exactly. And if it's a patient that I've just met,
right.
I can find out what they've been prescribed by other providers to make it, safer for everybody.
Well, I think we learned a lot today, and I think there's hope for the future, right, in general,
too.
with a lot of great work that you and other doctors in your field of neurology are working on. So thanks for coming in today. We appreciate it. We'll put some websites up on the screen again for people to go and learn more. Good stuff, good times. Dr. John Cahill is a neurologist, works at Rhode Island Hospital. Thank you for being on the show today, and I hope you come back again soon.
My pleasure. Nice to see you.
You can see this show and many others on our YouTube site. Until next time, I'm Sean Murphy. This is For the Record. Take care.